Hi, Abhishek.
Hi, sir. How are you?
All well, all well.
So I think we can start, Tisha.
Hi, Tisha. Good evening.
Good evening, sir. So, good evening, everyone. I am Tisha Tarsania, the State President for GAIMS Maharashtra chapter. I will be moderating today's session along with our host, Dr. Abhishek Kashyap, National President at GAIMS. We welcome all of you to this special webinar. We are absolutely delighted to have you all join us today for a session that promises to broaden our perspective on the future of healthcare. As medical students and young professionals, we often hear terms like digital health, telemedicine, artificial intelligence, and innovation in healthcare. But very often, we don't fully understand what they mean for us or how they will shape our roles as doctors in the coming near future. That's why today's session is so important. It is about, I'm so sorry. To guide us in this journey, we have with us none other than Dr. Rajendra Pratap Gupta, the founder and the chair of Health Parliament. Dr. Gupta is leading global voice in health and is the key architect of the National Health Policy, the National Education Policy, and the Viksit Bharat Abhiyan. He has been globally recognized for his pioneering role in shaping the domain of digital health, working with various multilateral bodies and governments. He chairs the United Nations Internet Governance Forum's dynamic coalition on digital health, the Commonwealth AI Consortium for Capacity Building, and the Global Chapters Initiative at the International Society for Telemedicine and E-Health at Switzerland. His book, Digital Health, Truly Transformational, is now a course book in several countries. He served as the advisor to the Union Health Minister, Government of India from 2016 to 2018. Through Health Parliament, Dr. Gupta has built one of the world's leading healthcare think tanks, influencing key reforms and policy interventions to make healthcare more accessible, affordable, and of higher quality. As the as the flagship event Global Digital Health Summit 2025 approaches, he stands at the forefront for this moment, offering us a unique opportunity to witness the golden era of digital health and explore how can we be a part of it. Before we begin, just a small request to everyone. Please keep yourselves on mute during the session. You may type your questions in the chat box as the session goes on. Towards the end, we will have a very short question and answer round where a few questions can be asked directly. It is truly an honor to have Dr. Gupta with us today. Sir, thank you so much for coming and over to you, sir.
Thank you, Tisha. It's great to have interact with the future of medicine, and I'm really fortunate for you to have considered me to be a part of your esteemed audience. No problem, Tisha. I think it was off the record. You can take it easy.
Tisha, you're on mute.
It's totally fine, sir. I guess we can start with the webinar. Thank you, sir, for coming in and over to you.
Sir, if you
Yeah.
we wanted to know your insights upon digital health because a lot of students we have here are, pretty new and they are mostly in their first year and second year, so they don't have an idea about digital health. So if you could share some insights about digital health and how it's going to impact the students as well as the medical fraternity in future.
Thank you, Abhishek. This is a domain that has evolved, I think, over the last 4 or 5 decades. We had a chance to work with the founder of this field, Dr. Jay Sanders, who started television medicine that became telemedicine. And all through, I think, for a long time, I have been in this field, and this field has evolved, right from e-health it started, then became telehealth, then, telemedicine, then virtual care, and then the term finally converged to digital health. In the WHO, when I was a part of the first guideline that we came in digital health, it has become an umbrella term as digital health. So to me, if you ask me what is the simplest definition of digital health, anything at the intersection of health and technology is digital health. And how it will shape the future is very interesting. And I think you are going to be the first beneficiaries or victim, whatever you choose to be. So you'll be a beneficiary if you start to understand. And as you get into the process, probably when you get into your internship, by that time, I think you'll be fully integrating digital health across the continuum of care. So first thing I would say that as first and second year student, start investing maybe a few minutes a week on it. I'm not even saying half an hour. I'm saying few minutes a week. Just try and understand that, because our way our education system is, and I was a part of the education policy committee also, we move very slowly. I mean, the academic council takes time to modify the curriculum, and technology changes every 6 weeks. So the dilemma is, while technology is integrating across the value chain of healthcare, the education system is not catching up with that. And also, I want to tell you one thing, that when you ask me what's future, so let me give you a sense of when you start practicing what you will see. Today, what happens is that if you meet a patient of diabetes, for a certain level of HbA1c, you will give glimepiride, metformin, and all those molecules. But just understand what happens. Like three of us on the screen, if we eat the same food, our body will break it differently. So how on earth will one medicine work on three of us in the same manner? Now that's the big challenge. And in the conventional way which you treat, we have only got one way to do it. That one medication for the same numbers that we treat. With digital health and the way things are evolving, you would treat three people in three different manners. Even the dose will not be same, the medication will not be same. So the way you practice medication will be very different. In fact, we put completely, I think, 2 sessions in the Global Digital Health Summit on what's the future of medicine. And you will meet people who are doing one of the most insightful experiments, Dr. Dean Ho, in National University of Singapore, and what it means to the field of medicine. While this appears to be very futuristic, but what is happening and what has happened in the country is something that we should take note of. Like if I ask any of yours, not only yours first, second year, if I ask even those who are doing MD, that what is digital therapeutics, I can tell you that very rarely that out of few thousand, one or two may know. But Government of India approved 2 digital therapeutics last year. And I can assure you that every chronic disease will have to use DTX. There is no choice. That's so impactful. So just imagine, this is not taught in your curriculum, but this is the norm. So things are changing very fast. I would say that as students and then those who will define the future of medicine, start spending few minutes a week on it. It's a very interesting field.
I totally agree with you, sir. The points that you have told, and in fact, I myself, like, I wasn't aware of the terms that you're using. A few of the terms are pretty, I signed up for your the Health Parliament app, and then I got up and sensitized, got myself sensitized about the topic. But I think a lot of us are still, we are very novice, or we are not sensitized towards the field as well as the topic. So that was really insightful. So now coming to the Indian perspective that you told, so what do you think are the biggest barriers in adopting digital health in India? Like it can be technological, regulatory, or awareness related. What do you think it's the biggest issue? And how students can really engage into this and overcoming these barriers?
So Abhishek, it's an interesting question. Let me flip it the other way around. What are the enablers? Let me talk about that. So there are people like you. I didn't want to promote Health Parliament here, but since you joined that, let me tell you my reason of starting. See, all of us are, facing an information deluge. While there is a knowledge deficit, there is an information deluge. You have so much available that you don't know what is right, what is wrong, what I should know now, what I should absorb, what I should implement. So Health Parliament I set up saying we should have authentic information that people can use. And we are happy when people write to us that the reports, the information was helpful in the thesis, in the dissertation. We are happy that we are serving that purpose. Now, having said that, let me come to the enablers. I don't see barriers. Let me tell you that. The biggest enabler are people like you. While you're hosting this webinar, you have no other intent but to tell your community what's happening, what should we do. So I think it's a curious mind. That's the first enabler. And now back it with what government has done. During my tenure at the ministry, I could see this would come. So we started the National Digital Health Mission, the National Health Authority. And when I ideated this first in 2014 in the BJP election manifesto. When I was writing the election manifesto for the BJP, I wrote the health section quite late because that's some sector that I knew little bit about it. I was been in healthcare for a long time. So what I put that we will have a health policy, that a country like this needs to have a health policy. After 2002, we didn't have a health policy. We said the first thing we'll do is set up a national health authority, put up a digital health ecosystem. 2016, I was asked by my boss then, who is now again the health minister, Mr. Nadda, that look at the health policy, please finalize it. I again put page number 32, complete mission. I mean, if you read page number 32, I've gone on to say what will the digital health mission do? What is digital health? Now, fast forward where we are now, over 800 million ABA IDs. That's 80 crore out of 142 crore citizens. 350 million e-Sanjeevani consultations. Now I think it's touched 400. Every day when you go to the dashboard, 400,000, 300,000. DTX approved. There are 17,000 smart beds in the country. So a nurse doesn't have to go and check every vital of a patient. She gets to see on her dashboard because the bed sheets are smart. And this is not theoretical. Last year it was 17,000. When the Dozy founder came and spoke at our summit, he showed how many hospitals are using smart beds. So when you look at all this, and there are doctors like you, I'll give you an example. See, for me, biggest inspiration is people like you. So 2011, 4 doctors left AEM after studying and started Biosense. You'll meet one of them this year again at the conference. And they started non-invasive medical devices. They built it to scale and sold it to an MNC. Now he started again something on neurodiversity. Again, phenomenal digital health venture. We are working together. So let's talk about enabler. So enabler is one, is everything is getting digitized. Government is moving faster than academics and industry both. So while you are not aware, government has approved DTX. And it's not just you don't know. I was addressing a big AI conference of all leading doctors. Not a single hand was raised, and Abhichas Sheth was sitting with me. He's the chairman of NMC. So the challenge lies in our lack of awareness. That's the first, I would say, the other side of enabler. But information is available, like platform like Health Parliament. I'm sure there are a dozen more they are available. Government is there. Policymakers, regulators have a clear DTX. The third thing, which is the biggest enabler, we done a study on that. 6 out of 10 patients know DTX technology, and 2 out of 10 doctors know it. Now look at this huge gap. So a patient can walk to you and say that, sir, I have migraine. Can you give me a DTX? And doctor say, what is DTX? It happened with me. I was told, that why don't you meet this young doctor from this big corporate hospital? She's a great diabetologist. I went to her and I said, do you know DTX? She said, no. I said, thank you so much. I don't want to be with you, because if you do not know it, I don't want to be treated with someone who is not aware. So patients are aware of that. And lastly, I think one of the biggest enabler is social media. Yeah, each one of us, when we get little time, we scroll Instagram. Patients do the same. Just imagine a patient gets to see a video by Boman Irani saying, hey, look, I have diabetes. I have to choose between laddu and barfi and this and that. And I use this. Now, everyone knows Boman Irani. They may not know Abhishek or Tisha or anyone else, but they will know Boman. So when Bowman advertises, and I guess these companies will start picking up stars to advertise. So this information democratization, the technology democratization, and government and regulators moving pretty fast is something that is fast tracking the adoption of technology. And the last thing that I am seeing as a bigger enabler, the e-retail companies. Now, a pharmacist on ground may not know what it is, but Tata 1mg, NetMeds will just send you a mailer that we have launched DTX now. Now, a doctor will be taken by surprise because they don't see you as a prescription. If I today buy a medicine on NetMeds or Tata 1mg, which is illegal, a doctor will call from the backend and say, hey, what's your age? What's the name? Okay, I'm sending you your medicines. So I think doctors have no choice. There are so many enablers that push you to adopt technology that everything appears to be like you got to learn yourself. Course will not teach you. I can assure you, even if your course teaches you, something new would have come that very week. So there are too many enablers. I mean, the barrier I see is our closed mind. That's the only barrier I see. Technology is not a barrier. Mindset is a barrier.
So I totally agree with that. And the points that you mentioned, like the system itself is the way it is designed, that we have to enable ourselves into getting the accustomed to the technology and the change that is happening. The change is very subtle. It's happening day by day, but it's happening. And if you look at the last 5 years, the telemedicine has been a game changer since the pandemic has boosted it so much. And now even when you talk about Dozy, I in my personal hospital when I'm on duty, I see there's the Dozy panel is always there, and I see the the triggers that we constantly get. So it's a good thing, and it also enables us, like we have a constant monitoring. So I think that is something good for the doctors as well as the health other healthcare providers, and even for the patient as well. But it's just that we need to accustom ourselves to understand these system, how these systems work, and get used to it. But so with that, I come to a next question about health parliament. And a lot of us are hearing about health parliament for the first time. And and even a lot of us asked us about what is a health parliament and how to how to engage themselves, and how to engage meaningfully and get exposure to policy making. And because they have very limited resources in mid school. So how students can get used to the platform, and how they can engage with the platform in a very meaningful way.
Abhishek, my reason of founding the health parliament was simple. As I said, information deluge, but knowledge deficient. Too many things. I mean, I look up on Google, I subscribe to newsletter, but question is, how many can I read? I mean, again, they are, the biggest challenge is advertisements. I am pushed an information down my throat, which I am not wanting to. It's not for me, but because someone pays money, they will push a news for me in the newsletter. So what was one fundamental principle we decided was we will never put advertisements. We will only do what is right for the person who is on the platform. And that is a principle that we have followed. So Health Parliament now is available as an app in 67 countries. I think before the end of the year, it will be all 204 countries. And where you get to meet like-minded people, there are professional discussion forum, and the name also was coined in that month. So professional discussions, nothing else, no greetings, nothing. Professional discussions, and it's a forum for professionals. So that you will find DGHS, you will find top policy makers, you will find industry CEOs, but very focused on the discussion. Even the information that you are given, the top news, is something you need to know. You can collaborate with people. We will be doing more. In fact, we do young leaders program. So we will call 30 of you. We will call a top policy maker. Like one of the times we called the inventor of Alexa. We called the head of public policy from the government. We called Chuchin Bajaj, who founded hospitals after being a doctor. So we let them interact, because see, the biggest thing you need today is inspiration. Knowledge would be available what you need, but you need to be inspired to use that knowledge. So our goal is on Health Parliament, give it the right knowledge, give you a forum for discussion on specific topics. It's divided into various topics: mental health, digital health. You can be a part of any of the forums, and as long as you're sticking to three, is absolutely free. What I wanted to do is, I think if I were a student, what would I do? I would want it free. I mean, max you got to pay is less than 10 rupees a day if you want to subscribe to all the forums, which is probably less than or at par with a cup of cutting chai if you stay in Maharashtra, or if you stay in Gujarat, almost the same. We are used to cutting chai there. So the whole idea should be that you should be able to get to make the best use of system. It shouldn't be prohibitively expensive, and then it should feed you with we don't overload with information. And Health Parliament is doing things not only one side giving information. We launched the biggest movement in the world, Digital Health Science Border, with Dr. Tedros on 19th of May. There are reports, every single report is free for you. You go to the app, download it. We will do like studies which are large scale studies, which you give you ground level realities. None of the rest studies you have to pay for. All they are free for you. I mean, anything else you need, you can always propose on a platform, and you can reach right to the level of influencer based on your engagement. But my goal was, can we create leaders of the future? So if you ask me in one word, what is the objective of the platform? We don't have large canvas thinkers. My biggest challenge is today, if I have to look at who are the large canvas thinkers in India, it's hard for me to find. I mean, at least on a platform where you engage with leaders, look at the discussion. Our target is, can we create large canvas thinkers who will define the future of this nation and probably the future of healthcare globally? So that is the objective. Health Parliament is exactly the platform that we built. We're adding more and more features that can help you in the future.
So just to give you an insight, I'm not, I'm just honestly telling you that I have been using the app, and we have been working with a lot of policies and statements and the reports, usually when you have to find quality reports. And also I go on the app and there's something, on the topic, especially related to digital health. And recently we had the Geneva Declaration on Digital Health Sans Border, and we were lucky to collaborate with you for that. So we have been incorporating all the such points into our mission and agenda, into our projects. So that has been a very insightful and a very resourceful tool for us as well. Now coming to that, sir, we have this the Global Digital Health Summit coming up in Mumbai. So talking about the summit, sir, a lot of students were, curious that how it is gonna, it's morely, focused with professionals, CEOs are coming and policy experts are coming. How a student can engage with these professionals and, how this is gonna shape their future, the summit part.
So again, Abhishek, all the initiatives I have started, they have been about creating the future of medicine. I'll tell you, we are a summit. We first formed our vision, and then we said we will do it every year. We don't want to be a conference, to make money. So our also the biggest challenge is fundraise because we don't go by sponsors agenda. So if you look at the very first session of the summit, what it is, can digital health fix a broken health system? Every single person who is in healthcare, no matter at which level you are, you will agree to the fact that healthcare system itself is broken. Can digital health fix it and where? So if you go at every section of this conference, like the future of medical specialties, I can tell you right now, there are two pathways for anyone into medicine. At least four specialties are at immediate risk right now because technology has reached a level of maturity and we are getting all those people who are working on it. So the best part of this conference is speakers have to be the global change makers to sit on the dais. You cannot just go because you are paid. We don't do that. So whether Joe Quader, who is coming from Harvard, he coined the term connected health. If you look up his work on Google and check who is he, you'll find out he's among the world's top people. Bakul Patel, he started Center of Digital Health at US FDA, led it for 30 long years, made US #1 country on digital health, coined the word software as a medical device, defended it before US Congress. He is the global head of strategy for Google. Look at anyone who is there. Vince, founder of internet. So any single person that you find there is actually a creator of the domain. What we want to do is discuss the realities. There's a lot of fear of AI. And what is the reality? I mean, is it still in toy stage where you can play with it, or is it going to replace people? The harsh reality is it has reached a level of maturity where it's going to create something which is disruptive. So I got all these people to say, let's talk about it. Like the one who leads Mayo Clinic's generative AI platform, the one who leads Mayo Clinic itself, the CEO of Mayo Clinic. Our whole goal is to talk about things that will help you shape your future. See, degree is something you will get, but what you need is knowledge for which you need to upskill over time. In the 3-day summit, when you walk out, you will be able to create your own apps, your own chatbots. And the security workshop, I was actually having a call with that person who is doing along with his team. We have no clue about what security has become and how important it is to us for your patient. So this entire 3-day meeting is where you don't only have to listen. Each session has 25% of the time dedicated for people like you. Pick the mic, ask a question from the person on the dais. Talk to them. I think one of the person who has attended all our previous summit, he actually bought a platinum pass for 80,000. So I asked him that, why did you pay 80,000 for a pass? I mean, you have been coming every year. You could bought a 10,000 pass. He said, no, sir, I want to be there. And what? And then it goes on to say that also that this is a conference where you're treated with respect. You can go and talk to anyone. Our goal has been go meet people, talk to them, clear your doubts, collaborate with them. These are all people who are driving the health. And trust me, in 3 days, you will get to know that the changes that have come, you may not know, but they're already, invading our turf. So whether it's medical devices that you use, whether it's the platforms that you use, future of medical specialty, future of medical education itself. I mean, we have a session on future of medical education. So all these have been carefully crafted, like where are we headed? How do we prepare? I mean, as I call the great reset is our theme. That what is the reset you have to do? See, degree you have to get your credentialing as a doctor. But will that be enough? And what else you need to do? The conference, this 3-day summit is going to clear you a lot of things as a doctor. And I think very early on. So you can be better and indispensable with technology, not sideline. But I think to use technology, you need to understand it. And that's what the whole idea of the conference is. And I think students like you have been coming every year. I think last year we had MSAI. This year again we have MSAI in good numbers. And they really enjoyed. We have and in fact I meet them one-on-one separately on the sidelines to have interaction also because we don't get to meet individually face to face. So I try and meet each one of you. And I would be happy if you come and look at what is going on, meet the disruptors who are doing, talk to them, talk to Bakul, like what is he doing at Google, which is so scary or so interesting. What is he doing as global head of strategy at Google for health? So I think all of us need to understand with those people.
I truly agree with you, sir. And in fact, this time James is planning to send a delegation to the conference, and most of the people who are going for this conference are who are actually holding leadership roles into different states, different college boards, so that we want the information, the learnings that they get from the conference, they disseminate it into their own regional and the local level. So that's why we are planning this delegation, and we are very thankful for the team that you have made it very affordable for James members. And with that, sir, there's another question that comes to my mind is when you mentioned about chatbots and all. So there is a AI certification level 1 that is mentioned, and there is a special sideline event on national medical education. If you could give some insights upon that, because we are interested in getting into and how we can contribute in that.
Yeah. So Abhishek, lot of summits or conferences are one-way monologue. Someone talks on dais, goes away, so you hear. I'm not saying conference is not valuable, they're valuable. Every single conference is worth its time you spend. But this time, what we wanted to do is to make people even not just update, but also upskill. So I said, while they update in these 3 days, you will get to know every single thing about digital health. Can we upscale them? That was the biggest challenge. And I need to get the best people. So, like on helping you create apps, I asked Bakul himself to take that workshop. So I know he's among the world's top person on digital health. He's going to teach you how to create an app without knowing coding, without knowing anything. Same way, we're getting another expert to teach you how to create your own chatbots. I think security workshop is something, I mean, when I put up, I thought it'll be routine, people will talk about security and all. But what I had as a call with the person and the way he developed that workshop, I think it's going to be a game changer for us to understand. It doesn't even apply to organization, it applies to individuals like us. And it is really scary. But there is ways to prevent, there's internet hygiene that we can follow. So my best thing here would be like learn, get certified for artificial intelligence. So you don't have to get scared, that, okay, technology, I need to get a tech guy with me. Not really. I think we have entered into an area where natural language processing is becoming natural language programming. I want you all to know that. There are a lot of scary words that people throw, and we say, okay, I have to go back to learn and do BTech. No, no, I don't want to do that. I'm better without it. But I think in these 3 days, you will not scare technology. You will be one of the experts in technology trying to tell doctors this is the way to do it. You don't have to learn technology. I think we will be very successful in doing that in 3 days.
That's really good, sir. In fact, I'm very excited for the level 1 certification as well. With this, last year you mentioned that if we are not in digital health, and so we are not in healthcare. So considering that a lot of medical, like we, our medical colleges are focusing on, the CPME curriculum that NMC has been laying the foundation on. So, but that has been very limiting in terms of digital health. So how young doctors like me and other my colleagues, how we can start our journey with digital health? Where should we hunt our information? Like you said that you should read about digital health, but where to find the right information? How to begin with? Is there any certification sort of thing that is there, or any courses that we could do? Or free resources, or what platform we should use so that we can begin our journey at least to get an orientation about this.
So, way back in 2019, I started Academy of Digital Health Sciences. When that time there was no COVID, but I realized that, the way world was moving, digital health would get integrated. So let's prepare everyone. And I clearly had this in mind because we're working, I chair the UN committee, the IGF's committee on digital health and Commonwealth Day Consortium. So there's a lot of things happening globally. Couple of things. One is you can be at Health Parliament to get info for free if you just join that. Second is you can do essentials of digital health course, no matter at which level you are, in a matter of 6 months, spending half an hour a week. That's available to you. You will get to know digital health from a broader ecosystem perspective of what digital health means. Then, if you decide to get deep dive to make digital health your specialization, and I think I keep saying that no matter which specialty you are, digital health has to be a sub specialization. That's the way it has evolved. There are very senior doctors. If you go and check the website digitalhealth.ac.in, doctors have done 1 year full-time course that we run with IIM Raipur on digital health. That's a deep dive where you become a certified digital health professional. Now, to make sure that people get regular updates, in this summit, we are going to launch two initiatives. One is a journal called Evidence, and that's there to support the generation of evidence for digital health, and a newsletter called Trust. So you can get trusted information on digital. And this is being done by people who are formally trained by us in digital health. So it's going to come straight to you and it's going to be absolutely free. I mean, we're not going to charge. The whole idea is to get people authentic information. But I would say that, try attend conferences, meet people who know digital health, try to form a study group within your city or your medical college, and let us see how we can help you not only use technology but also create technology. I'm a firm believer that we all have to be creators in this age, not be just users. And one of the studies I still have to put on LinkedIn. I think my belief is 90% people are being used by AI and only 10% are using AI. And even that 10% would be like an exaggerated number. Because if you're just using AI, you are training your own replacement over time. It's just learning your expertise. So in fact, AI is using you more than you are using AI. And we got to flip that. We can't be someone like a patient who's all that you have been talking through using an AI tool. So I think we all have to seriously think while studying is very important. It takes all of your time as medical students, but think about what you have to do for the future as well. I think you need to take out few minutes a day. Think about what am I going to create, and if you see the doctors in India, what they have created, it is better than what world needs. I can tell you right now, India has done phenomenally well on technology.
So, one thing is there that digital health is will be a game changer, and in fact is really impacting in today's world as well, and especially like country like India where rural and resource limited areas are there. So what are, since you have a wide experience and wide exposure and access to people around you, the community, so what are some examples that really inspire you the most, something that pilot project or maybe some project that has really inspired you, that students can learn and they can work and replicate or get some ideas to begin with, any project or any initiative?
Yeah, surely. So let me tell you that how I see digital health in India. Let me give you some large scale examples. You have heard about 108 service.
Yes,
So
sir.
this was started by Ramalinga Raju, the former Satyam founder. And when I think long time back when I visited his Hyderabad command center, he demonstrated me, his team demonstrated me how they had reduced the response time in rural areas for ambulance to 22 minutes, in urban areas by 15 minutes. I was surprised. There's another friend of mine, Dr. Anand Nayyar, he's an American. So Anand, me and Bakul used to stay in Bethesda 15 years back. Bakul had just started the US Center for Digital Health in the FDA. Anand had started WellDoc. What eventually became was WellDoc became the first approved DTX by US FDA, and Bakul's team was the one they approved. Luckily, all three have been friends of Indian origin. I have seen new things coming. Let me also tell you an example that you will relate more. If all of you look at your computers, you will find that logo Intel inside. It's a blue color small logo that they put. Now, Intel became so big, they thought we make intelligent machines. We are the most valuable company. Every chip is Intel. They ignored what most doctors ignore today, what was coming. They said, no, no one can touch us. We take all the chips. Last year, when I used to make presentation on digital health, I should tell second quarter of 2024, Intel made a loss of 1.6 billion. By the time I started touching third quarter, $16.6 billion. Now that's the world's most powerful company on intelligent machine and computing. They became loss making. Their CEO went out. And what was his last statement? We are out of competition. Now just imagine if the biggest and the brightest and the most intelligent computing company is out of business, and which has come into on January in 2022 third quarter. There's a boy called Sam Altman who appeared. Every company ran to invest. Microsoft invested $10 billion. It was not to save Sam Altman, it was to save themselves. Today, every single device, whether it is Apple or Android, they use his company product. So you can understand, where what it means to you. Some of you can become global disruptors, like Sam Altman. And I can also tell you one thing: whatever you are seeing today is not even 1% of the what world will produce now. We will have many more disruptions to come. We are doing ourselves as what we do, as an organization. And I believe that the golden age of medicine has just arrived. And as I said, either you are going to be a beneficiary or a victim, depends on how fast you have moved it. And so what lies is keep your hunger alive, keep your curiosity and never give up. If people say this specialty is going to go out of business because of technology, let me tell you, anyone who starts using technology will become indispensable, no matter which technology comes in. So the doctors, the nurses, the pharmacists, anyone who uses technology, learns and masters it, they will be indispensable. Rest will be, of course, disposed of. Also, that's also a harsh truth. I should not say that no, because 10 years back I said it as chairman of HIMSS. There is always, luckily, in this digital era, everything is available on record. Like even whatever we are talking today will be available somewhere, someplace. You are sharing it on YouTube, and there's nothing that I can say I said I didn't know. I stand by and I very responsibly state that doctors who master technology will be irreplaceable, and those who don't can retire. That's why I say either reset or retire. So you have to reset your future. That is with technology. Don't make technology your master. You should master technology.
So what you said is something, a few days back I was listening to a podcast and they were talking about that, when dynasties or when leaders, they get that ego and ignorance that, nobody can replace them. And that's the time when the downfall starts. And it has been history. And I think if doctors as a fraternity, they don't, start working or, getting sensitized and understand how the technology is working, that will be the time when, technology will be taking over the physicians as well. So we need to, get used to it, how it functions. And the good part is that there was a time when people you had to learn programming and coding, but now it has changed with chatbots, with AI coding. You just have to give an idea, you just have to work on it and see how it works. And somebody was telling me that, even if doctors are learning about prompt engineering, how to, give proper commands to the AI will work for you, but you should know how to get, your work done with AI. With that, sir, and we are coming to the end of the session. So some insights or some, tips for the students who will be coming for the conference, what homework they should do and how they can take the most of it from the conference, since it will be a networking event for them and a learning experience.
So Abhishek, I always say that learn to capture conversations. The most powerful thing on earth is conversations. When you spot something, try to be in that moment. When you hear windsurf or when you hear Buckle or Joe Quader or Dr. Elia, when you spot something is important, when they come down the dais, I can assure you they're going to be there for 3 days. See, we take care of people. This is the most invested summit. We invest a huge amount of money so that people don't just do lecture and go home. They're going to be there. Go clear your doubts. They are the most humble people as well. And I think sometimes one trigger is going to be changing your life. Make sure you need, I would say that despite your doctors, I think all of us in very early stage don't carry our cards, but make sure that, if you have your cards, connect with them, take their email, write to them, connect with them, learn, and at least take one resolve to go back that I'm going to change this part. And I can assure you from us as an ecosystem that we have as digital health, whether the summit or the health parliament, we are going to be with you. Our agenda is not to think about money, but about change. We always say that our vision is to fast track the golden age of medicine. Everything you do today, you will not do in 3 years. That's the maximum horizon you have. Who will create that 3 year horizon? It is going to be you. Don't think the Microsoft of the world or Google will do. It's like the Sam Altman who didn't, no one knew his name before 2022. Suddenly he becomes the big guy. So I think many of you will end up becoming. So always carry the positivity in your mind and watch conversations, watch people, how they behave. We are very young in our life to watch them and meet them today. And I think it should inspire you to do big things. And trust me, each one of you has capability to become bigger than what is the biggest today. I can assure you that some of you will be disrupting the future of medicine.
So I think your talks are really going to inspire a lot of participants today, and surely they will come up with something. And I think with that, somebody has asked a question regarding the same. For those who are looking into creating tech solutions, how should they look for a problem statement? We have a question.
So very interesting. We with the National Human Rights Commission, we started a patient fellowship. It's a very interesting fellowship. This is run by another SBU Patients Union, International Patients Union. So what we do is when you join that fellowship, you work with the patient to identify their challenges and you report back to us. If you really want to find solutions, go into trenches. When I wrote policies, I never wrote policies from the AC chambers. I wrote policies going to villages, talking to people like you who are the best of ideas. The best ideas are not in air conditioned rooms. Go out. If you're every Sunday, if you watch my LinkedIn, every Sunday probably I try to go out, fly out, go to a hospital, talk to patients directly. And then I realized that future is going to be more exciting than it is. The as doctors, your future lies in the people you're going to treat or attend. Spend time with them. They will tell you patients are the best teachers, and Teachers' Day has just passed. So I would say that remember who are your best teachers. Patients are the best teachers.
I think Rana got her answer, and patient are the best teachers, I would say. And sir is right. You should. The problem statement is when you work with the patient, then you identify the problem. Where are the problems? And that's how big tech firms, be it Paytm or be it other platforms that were formed, they identified the problems at the local level, and then they got up and made those platforms. So thank you so much, sir. And now I would like to hand over the stage to Disha to conclude this session.
Um, Thank you so much, sir, for the wonderful session. I'm truly sure that by leaving this session, we have a clearer vision of what Health Parliament and GDHS is going to be, and why is it so important for us to, as healthcare future professionals. I would also like to thank all the participants for joining in and for all your presence. As the next step, we'll be sharing the registration link in our groups as well. So thank you so much, and we would be very excited to see you all in Mumbai. Thank
Yes,
you.
I look forward to seeing you in person. Have a
Yes,
lovely
Thank you.
weekend. Thank
yes,
you.
sir. We are very excited to be meet you in person as well, and really,
Likewise.
really excited to see attend the workshop as well as have a fruitful discussion with you. Thank you so much.
Lovely. See you there. Bye
Take care.
bye.
Bye.